but that does not mean that we shouldn't like continue with it, you know? So there is a lot of preparations that we need to take in order to take that exam, including practicing, taking samples, taking more mock exams, and a lot of other things that you can do. Mainly practicing and having the samples written and like having the mock exams is really particularly important because you can see your progress. You can see how much you're actually achieving, you know? So that's really, really important. And then the preparation, there is different academies, there is a different people that you might need to take their advice of what you're doing. And some people are actually providing some services like in writing, you can't really assess yourself when you're writing or when you're speaking. You can't really assess yourself. So the thing is, we need some help. If you can find a partner who's willing to help you with the preparation of the English language test, that would be really good. If you don't, then no worries. You can do the reading and the writing on your own. But for the listening and speaking, you can find some of the partners on the groups. You can have some of the courses like E2 language or others. There's a lot of OET and IELTS preparation courses that you can take. Regarding the exam, taking the exam is a little bit challenging because you're under a lot of stress. You're thinking that this is the first step out of the UK. You're thinking, what am I doing? Am I on the right path? And then taking the exam is a little bit giving you some anxiety. But I want to assure you that once you're in, give it all you have. And if it's went good, then that's it. If not, then you can always try again. It's not the end of the road. I know a lot of people who have tried several times for the English language test, and they've passed eventually, and they've started their career in UK, and everything seems okay with them at the moment. So just because you failed one or two attempts in English language test does not mean that you'll need to give up. That's just the start, okay? And now we're coming to what's next. The very challenging part in the PLAB journey is actually securing a PLAB seat, which is a PLAB 1 seat. This is really, really challenging because PLAB 1 nowadays is very competitive. It's run 4 times in a year. That's in February, May, August, and November. And you can find like most of the exams already pre-booked for like the next year. So that is really stressful. You're thinking, what am I doing? Am I even gonna get a seat? I want to assure you that as long as you started your journey, as long as you've finished and cleared your English language test, securing a PLAB seat is not very difficult. GMC usually say when they are releasing seats. I think they're releasing next week, a couple of the seats for the next year. However, if you are unable to secure seats, you can always keep on checking on the website. You would find a lot of canceled seats. I know it's a little bit difficult, but it's not impossible. You can secure a seat by canceling. And I know a lot of people who secure their seats by checking for a canceled seat and then they booked it. Another thing for the PLAB 1 exam, it is what is this exam? This exam is a written exam where it checks your clinical knowledge. That's a 180 MCQs, okay? In 180 minutes. So basically 3 hours. It's not a very challenging exam, I would say. I mean, a preparation of 2 to 3 months would be more than enough. There is a couple of resources like Plapapool and others, Samsung. They have like question bank. You can go through them. Then you would really do great if you answer these questions 1 or 2 times. That would give you a really good perspective of how the exam it is. So the preparation can take 1 to 2, 3 months, depends on your clinical knowledge, really. But it's not a very difficult exam. A lot of people pass with very minimal preparation. I always say that it's just the same as the internal medicine exam in our 6th year final exam. It's not, maybe even the internal medicine exam was a little bit more difficult than that. So it's not a very difficult exam, and the very tricky part is securing a seat for the exam rather than actually taking the exam. On the exam day, you would find the very challenging thing is the time, because you only have 3 hours, and that's the main problem with the exam. Not the difficulty, but the time. So time management is really crucial when you're taking the PLAB 1 test, okay? The results usually comes in 42 days. That's 1.5 months. After getting your results, then you're going for the next step, which is the PLAB 2. Getting a PLAB 2 seat is not as tricky as getting the PLAB 1 seat. It's available because it's run every single day during the week, except for Sundays. They don't run PLAB 2 on Sundays. So PLAB 2 seats are available. You can get even up to 3 months early. Like the earliest thing that you can get is 3 months, to be quite honest. Sometimes you can get a little bit of canceled seats in less than that, but the main thing is the 3 months, 3 to 6 months. So you can have like PLAB 2 seats with no much difficulties. The very, very tricky thing about the PLAB 2, it is the visa application, because the PLAB 2 is only run in Manchester, in UK. And as you know that as Iraqis, it's not very easy for us to get the visa. It's very challenging. You have a lot of preparations to do. So what I would suggest is you start preparing for your visa application just when you finish your OET. What does that include? That include starting a bank account, making it very formal, and making regular deposits, regular withdrawals, so that you're showing them that you're financially able to come to the UK. And that's the most tricky part, the financial aspect. If you got that right, then the visa is pretty much easy. I've done a video on visa that you can check later if you want. Regarding the structure for the exams for the PLAB 2, we have 16 stations. That's an OSCE exam where it assesses your clinical knowledge. PLAB 2 exam, I would say, is not an easy test, but in the same way, it's not a very difficult test. So it's a medium, okay? If you go on thinking like this exam is an easy test, I'm gonna pass, you'll fail probably. But if you went there saying that this exam is very difficult, and you might find yourself having a very like great amount of anxiety, and you would also fail. So what I would suggest is stay calm, make sure that you're preparing well. The preparation period might take 3 to 6 months, I would say. Know your clinical knowledge. I would suggest that you know what they want from you, which is the three aspects: the data collection, the management, and then IBS, which is interpersonal skills. If you go through these structures, the three aspects, I guarantee you that you will get your PLAB 2 cleared very easily. A lot of people thinking PLAB 2 is tricky because it assesses your English language. This is not true. PLAB 2 does not care about your English language. English language has already been assessed when you were doing your English language test. What they are assessing is your clinical knowledge. How do you approach for the situation? How you do your interpersonal skills? I mean, okay, English language could help you a little, give you a little bit of bonus, but it's not everything. A lot of people who cleared it have like not very good English, but they have really good interpersonal skills, so they cleared the exam really easily. I know a lot of people who have perfect English language and they still fail the exam. So if you're thinking that your English language is the problem, it's not, I assure you, okay? The tips and the tricks for the exam is a little bit long, but I would suggest the good preparation, not following scenarios, because a lot of people go in thinking that this scenario I know, doing the same scenario. This is not what they want to see. They're not looking for you if you know the scenarios or not. They're looking, how are you approaching the case? So that's a really important issue of the day. The exam day and the results. The exam day is a little bit stressful, I would say, because it's OSCE exam. I mean, who doesn't get um, uh, anxiety on the OSCE? We all do. But what I would suggest is trying to stay calm, good preparation. When you enter the exam, stay focused. Try to look for your time. Don't be too quick. Don't be too slow. The best thing is always take your history, do the management as you would do as a doctor. Because sometimes we're so stressful, focusing on what we've been told, focusing on what's in the scenarios, and then we forget to act actually as doctors. They're really assessing how would you act as a doctor. So just be yourself, and then that would be fine. All right. That's regarding the tips and tricks. Try not to be scripted, stay calm, always address the patient concerns. This is really important. And the PLAB 2 journey, usually like the results gets in 4 weeks. You would get it in 4 weeks, your results. If you passed your PLAB 2, congratulations. The hardest part is now being cleared. You have one small challenge left for yourself. That is the GMC registration. GMC registration is the end of your journey where you would do an application where you're putting all of your documentations to actually get the license to practice medicine and the GMC registration, which is our goal. When we started, we we're looking for GMC registration so that we can practice medicine in UK. GMC registration is becoming a little bit trickier and trickier every day because there with a couple of challenges there. We're going to talk about it in a minute. You will need to be very focused, not giving the wrong idea, or else you might not get a GMC registration, and it would be really, really devastating because you've actually cleared off all of your exams. You're actually ready to move to the UK, but then you would think, what did I do wrong? Why did that happen? So that's why I'm saying always keep an open eye, trying to stay focused when you're doing your GMC registration. The
Zain, you have
documents
5 minutes.
needed.
Zain, just you have
All right,
five
yeah,
minutes. Yeah, thank you.
perfect. Almost done.
Yeah, okay.
For the GMC registration, I would say the documents that you need is your passport. We all have that. The primary medical qualifications, that is the what we call in Arabic الجدارية مع التخرج. Don't go for the script, transcript, which is الوثيقة مع التخرج. So go for the final medical diploma because GMC wants your final medical diploma. They don't need your final medical transcripts, okay? What you can do for this is you need to verify it through EPIC, ESFMG EPIC. And then when it gets verified, you can send it to the GMC and that would be okay. The other thing that you would need is the certificate of good standing. So a certificate of good standing is really important. When you get your certificate of good standing, you need to send it to the GMC so that they assess it. And now, the first thing about this certificate of good standing, which is really, really important, I would say, is the certificate of good standing is something that you get from the Iraqi Medical Association. So I would suggest, and please, always when you graduate, please go and join the Iraqi Medical Association. Iraqi Medical Association for GMC is the authority that gives the license to practice medicine for us as doctors in Iraq. So if you get the license to practice medicine from the Iraqi Medical Association, you're good to go. If you don't, then that's a really, really big problem because you will waste a lot of time when you're working as a doctor, but you can't actually say you were working as a doctor. We'll come to that part later. And you'll need your OET certificate. The other thing that I would need is internship. An internship is equivalent to FY1, which is foundation year one, which they need here in UK. For us as Iraqis, it's the 6th grade. So if you've done your 6th grade in medical school, that's all right because you have your pre-graduate internship. I would say that you would need to be very, very sensitive while filling your pre-graduate internship because if you've done it wrong, you're not getting your GMC registration. The other thing is a Gen 1 forum, which is if you have done any non-clinical work or you have been working without actually having a license to practice medicine, like an observership attachments, you can fill that form and get it. The challenges for the registration is really two. The first one is the gap. A lot of us does not have Iraqi Medical Association registration. And then when you're there applying for GMC registration, they have this gap where they actually were practicing medicine and but did not get the Iraqi Medical Association, which is the license we need. So they have a gap. And the only solution for this one is just to say that you were doing observership. That's my main advice. the online learning is, I would suggest that you'd always be honest to the GMC about your situation, because if you're not, you can get into investigations and others. So always try to be very, very honest with the GMC when you're telling them about your registration and the situation. The online learning is a little bit of a problem nowadays. So you would need to tell the GMC about what online learning you have, what modules, and when was it, in order to get your GMC registration. And the last thing is, if you get your GMC registration, you're ready to go, you'll be trying to secure a job. And then that's it, I guess. Congratulations, you've passed your PLAB journey. I would look for any question if needed. You can email me, you can ask me for any questions, and I would check the chat just to say if anyone have asked any
Thank you, Zain.
questions.
Thank you very
We
much.
have time.
The question, the Q&A would be at the end. Islam
At the end, all right.
The Q&A would be at the end, and Islam would organize that. And I can see there's already a few questions coming up. And by the way, Iraqi Medical Association for Iraqis يعني النقابة نقابة الأطباء يا بسجلوا كلكم بالنقابة. Yeah, but thank you very much, Zain. This was a very lovely and very clear presentation. Very nice of you. Can you stop sharing now so that we can go to the next speaker, please? So the next speaker is Dr. Hassan Al Ibrahim. I tell you something about him. He's one of the junior doctors who graduated from Baghdad Medical College in 2017. He had his internship at Sheikh Zayed Hospital. Then he started working as a primary healthcare provider in Al Madian Primary Healthcare Center. مدائن العفو مدائن عافية حقك مدائن what is equivalent, and then he become what is equivalent senior house officer in neurology in Rumadi Teaching Hospital, Al Main Hospital Rumadi. That's in 2021. He was SHO in neurology. He started his journey after he finished his qualification in late 2020. Then he did a PLAB 1 and a PLAB 221, and he didn't take a very long time. So he's here today to tell us about his journey and the obstacle he faced and the way he overcome them. So we are so glad to see you, Hassan, with us.
Thank
Please,
you very
much. Share your document and start doing your talk.
Assalamu alaikum. I'm Dr. Hassan. I'm a junior clinical fellow right now in Royal Gwent Hospital in Newport, which is in Wales, in the UK. So my journey, as doctor said, I graduated from Baghdad College of Medicine in 2017. I had 2-year internship in the Sheikh Zayed General Hospital. Which is طبيب تدرج, primary healthcare provider in Madan Primary Healthcare Center. And then مقيم أقدم اللي هو senior house officer in neurology in Ramadi Teaching Hospital. I did OET in September 2020, PLAB 1 in May 2021, and PLAB 2 in October 2021. And I got my registration in December same year. Then I started working after about 1 year in UK. So basically, as Dr. Zain mentioned, how to practice medicine in the UK, you need a language test, which is either OET or an IELTS. And so you've got 2 options of exam. There is a PLAB test or the Royal College exams, which is either MRCS or MRCP, which is not our topic today. Then you get registered and you can find a job later. Just a quick advice regarding either during planning your journey or just before starting and after you're making your decision. as Dr. Zain mentioned, you need to join the Iraqi Medical Association soon as possible, because if there is a gap, if you delay that, it will be considered as a gap in your practice in medicine. So you will have problems and you will need to fill forms. After getting your certificate of graduation, you can get ECFMG certified even before doing your exams, even before doing the OET. So you can do that as soon as possible as well. And try to make your experience in Iraq useful by building your portfolio. Try to do audits, if you're interested in a specific specialty, try to look at online, try to find what is the requirements to enter training in this specialty or to find a job in this specialty. Everything is available online. You can find it. The next decision will be how to choose between PLAB and Royal College exam, basically. It depends on multiple factors, really. I mean, if your mind is doing medicine, you can do MRCP. It will take time. PLAB exam, it will take a shorter time, but there is an option. You can do MRCS as well. Sorry. So I started with the OET. How to prepare OET? As Dr. Zain mentioned, it's an English language test for healthcare professionals. 4 skills is assessed in this exam: reading, listening, writing, and speaking. The most challenging part that I found is the writing bit. Is just you need someone to test your writing skills. I think I'm for myself, I needed a course to do that. It's just it took me a while, and the writing bit I found it difficult for me, but with the course and everything, with the practice, it became easier. After doing like 3 letters, 4 letters of writing, it became easier, and I got the mark. I passed it with the first trial. So how to prepare, as I mentioned, speaking is, I think you will need someone to practice with. It is very necessary to practice with someone about speaking. And right now, it's easier to sit for the exam. Before, there was no OET at home. I did it in Dubai. Right now, you can do it from your home. And I think there is also in Suleimania, you can do it. So it's easier nowadays for the OET. PLAB 1, it's a written exam, 180 questions in 30 hours, basically 1 minute every question. Cost is 250, basically. Maximum 4 times you can do it, and 1 final attempt, so basically maximum 5 times. Pass score varies from year to year, from exam to exam. It depends on the overall performance. How to prepare, as Dr. Zain mentioned, you can do PLABable. I found it useful. It's a bank of questions. There are so many questions in it. Basically, I solved PLABable, all the questions. I repeated it like 2 or 3 times, and I entered the exam, and you will find the exam manageable after solving these questions. Regarding where to sit for this exam, you can, I mean, if you live in Iraq, the easier, I think, to sit it either in Dubai or in Egypt. Sometimes it can be tricky finding a seat. I know friends who did it in India. I know friends who did it in Sudan. Basically, if you can, wherever the seat that you can get, just do it there if there is no other option. PLAB 2 is an OSCE exam. It costs around 934. It will assess your medical knowledge. It will assess the most important part, communication skills. I found that the communication skill is the most tricky part. We've got the medical knowledge. You can study the medical knowledge. It's just we need to practice more on our communication skills and how to deal with difficult situations and how to deal with everything, basically, how to communicate with your colleague, how to communicate with either a patient refusing medicine or a patient refusing treatment or anything. You need, for a PLAB 2 exam, you need 10 stations out of 18. Well, basically 18 is including the 2 rest stations, is 16 basically. You need to pass 10 stations of 16, and there will be also an overall mark that you need to achieve, which is also different from exam to exam, from year to year. Yeah. PLAB 2 can be done in Manchester only. It was challenging before to book a seat, really, but I think right now it's a bit easier for PLAB 2 than PLAB 1. The most challenging part was how to sort the visa. I'm gonna talk a little bit about the visa, if that's okay. It's a bit challenging for Iraqi to sort the visa. So the most important part is sorting your bank account, because you need to take that decision early, even while doing the part 1, even while doing the PLAB 1, I mean, sorry. So start sorting your bank account more than 6 months ahead of your planned exam. Start to deposit deposit money which is enough for the exam and the travel, and then start putting money in the bank account every month, certain amount of money, and start withdrawal also from the bank account. Basically keep the account active every month, because they think that we earn money by card and we spend by card, but actually in Iraq we do most of this stuff in cash, but they don't know that. So you need to show them that you are doing like this way. How to prepare? Basically, you need to practice a lot. The most important part is to practice. I took a course in Manchester, which was 1 week. I took it in Liverpool. I took it for 1 week. It was challenging because there was COVID, so it was difficult to travel to Manchester, and you need to stay at home like 1 week at that time. So the time was really tricky. I got only 1 week, but it was enough. I passed it from my first trial. It was stressful, especially at the day of the exam. But if you practice a lot and you practice in front of other people, not your friends, just try to practice with other people that you don't know, just to test your stress level and test how you are doing. If you take a course, it will be easier to do that. There will be mock exams as well. You can do that, test yourself, just practice a lot. After that, you get the GMC registration. As Dr. Zain mentioned, can be tricky sometimes, especially if you're not registered with the نقابة الأطباء العراقية. If you're not registered early with the Iraqi Medical Association, can be tricky. There will be a gap. So if you've done that, if you've done your ECFMG earlier, that will make the time shorter to get the GMC registration. Basically, I prepared everything before even doing my PLAB 2 exam. I prepared everything. It's just that the certificate of good standing, there's a time limit for that, so that you do need it just a short time before doing your GMC registration, so that you cannot prepare. But everything else, I prepared it. I prepared my ECFMG even before doing my PLAB 1 exam. And yeah, that's it, I think.
Okay, Dr. Hassan, thank you very much. Yeah, short and sweet. Yeah, you said the most important things, and now I just want Dr. Majid Jawad to welcome everybody. He's the vice president of our association, and he's a well-known pediatrician. He's a senior examiner as well. And it might be very helpful to learn some few tips from his very long experience with dealing with postgraduate medical student as well. So Dr. Majid, are you there or? Dr. Majid, probably he's not there. Okay, it's fine. So if he's not there, then we go to our next speaker, our lovely Dr. Noor, who is one of our brilliant EC members of our society. She joined us a year ago, probably more than that. And Dr. Majid, are you still there? Oh, so what is it? Is Majid still there, Dr. Majid? No, I don't think he's there. Just let's carry on with the no, she's one of East. Okay, but again, Islam. Let's just start with no, and we keep Marwa till the end, and then because essentially she need to sort out herself. So let's just go back to Noor. Don't let me just start from beginning. Dr. Noor Ammar, she's one of our executive committee members of the IMA UK and Europe. She joined us more than a year ago. She's a very active member. She's a very brilliant young doctor. She gone herself through the PLAB journey successfully. And not only that, she managed to get a good job. She's on a rotation now. أنا ما أريد أحسدها بعدين تقول أحسن. So what she's going to talk to you, she's going to talk to you about a different thing, about the post-PLAB journey. جيابة بلا حسد وأنا ما أحسد usually, so I leave it to you. No, you can start your talk, please.
Thank you, Dr. Naqash. I feel like you've pumped me up with a lot of hot air and I'm a floating balloon right now.
You deserve it, fully deserve it.
I hope I live up to it. Hi, my name is Noor Ammar. I'm a GP trainee, GP registrar in Manchester. I'm also a medical leadership fellow with Health Education England Northwest. And I'm going to talk to you about what happens after you pass your PLAB. My colleagues before me have already touched up on this, but I just wanted to make sure to signpost you to a few resources because my presentation, the main point of it is to signpost you to resources that are important to you and what I would have appreciated when I was going through my journey a few years ago. Once you pass your PLAB, you're going to need to do your GMC registration, and Dr. Moussawi's already pointed out that this is quite an important step because any wrong moves in this step and you can lose out on all the effort that you've put previously. So I've linked in two blogs on here that two Pakistani colleagues, IMGs, have started when they came to the UK. They're very helpful. They have frequently asked questions for the GMC registration. But not only that, they have frequently asked questions from A to Z about coming to the UK. So from your OET all the way up to coming here and buying a house here. It's a great, great blogs. Please screenshot if you need to. And there's the IMG group on Facebook as well, which you can join and ask questions on regarding the GMC registration process or really anything about the UK process. And you can even post anonymously on it. So that was just briefly for resources right there. The main point of my presentation now is to talk about the pathways that you have available in the UK. The UK is amazing in that it's very different from other countries like the US and Canada because it has very flexible pathways. And your journey will differ based on what you want out of it, so your career plan, where you currently are in your career. Are you someone who's currently a medical student and you want to come here immediately afterwards? Are you someone who's already a consultant in your country and you want to move abroad? But it also depends on the job opportunities available here and the training opportunities available at the time you're coming. And I want to stress that the most important first step, I would say, and I think the majority of people coming here would agree with me, is getting NHS experience. Remember, you're coming to a new healthcare system. They have different guidelines than what you're used to. They have a different culture than what you're used to. So you need to keep that in mind. And I'll tell you where this comes into play, the importance of this in a little while. So what are the options that you have available to you? Quite a lot, actually. You have the first things that you have available are your clinical attachment or your observership. And this is something you want to do before you start here. So you can do this when you finish your PLAB 1, you could do it when you finish your PLAB 2, and you could do it after your GMC registration. If you do it after your PLABs, I think that's a good period because you don't need to be GMC registered. I will speak more about it in a little while. But because you'll be on a visit visa anyway for your PLAB, so I think this is a good time to utilize that visa and do the attachment. The other option is a training pathway, and then you have the non-training pathway. Again, we'll go into more details in about all of these in a little while. And then you've got your locums. Okay, so this is the clinical attachment and observerships. I've linked some resources for you. You can screenshot these, or please put your email down in the conversation in the chat box, and I'll take it down and send you my presentation with all the resources in it because I think it will be very useful to you. So your attachment is going to help you gain some, like an overview of the NHS. It's not going to help you gain a lot of experience, but at least you'll get an idea of how it works. You're not going to be working, you're just going to be observing, so you don't need a license for this. You're not given any responsibility. And again, like I said, the main time to do it is when you have a visitor visa, when you're doing your either one of your PLABs, if you're doing them in the UK, for PLAB 1 that is. Because you cannot get a visa specifically for a clinical attachment. Correct me if I'm wrong, I don't have any expertise in this area. Yeah, so that would be that. The other thing is, for clinical attachments, you do not have a unified application. You need to know a consultant or a specialist who can put you in contact with a consultant or department. So you can email them and ask to do the observership or clinical attachment, which is the downside to this one. Now, locums, as the name suggests, it's the same all over the world. It's basically a temporary vacancy that you can apply for and fill. The problem is when you're coming on a visa, you need to be sponsored, which means you need to have a sponsor. Okay, so for a locum, the NHS trust the hospital is not going to sponsor you because it's a temporary thing. You're going to do it for one day or a few days. It's not long term. So some people on a visa will apply to a locum agency, and the agency will sponsor them, and the agency will send them advertisements for vacancies in the UK. The only downside to this is that locums they're not always in the same hospital, they're not always in the same department, and they're not always in the same city. So sometimes you're going to have to travel between different cities based on what vacancies are available. And these vacancies are usually doctors who normally work there, permanent staff that are absent, doctors who are on sick leave or maternity leave, or during periods of time when that department is very busy and they need an extra pair of hands. You can also do locum work if you are here already in a non-training or a training pathway. But because you'll be on a tier 2 visa or a skilled worker visa, you will have restrictions on that. That's 20 hours maximum per week of locum work. It was stopped during COVID and it was limitless, but it's recently been reinstated, unfortunately. The other thing is you need to remember there's tax implications when you do locums as well. Because if you're in a regular training or non-training job, you already have your salary and you're working a locum, which gets hourly pay. So that's on top of your salary as an extra. And again, it needs to be taxed. So you might reach a certain threshold, which puts you above a tax bracket, and then you're taxed a lot more than you're expecting. All right, so now that we're done talking about locums and clinical attachments, let's get into the pathways here, which is your training pathway and your non-training pathway. And the first thing I want to touch on is your training pathway. You can apply for this after your GMC registration, obviously. Now, the considerations I want you to think about is what I spoke about before, which is it's not advisable to get this job as your first job in the NHS. And the reason is because when you're doing a training post, you are expected to have the level of skill and expertise as a doctor here who has finished 2 years of internship here. So you're going to say, yes, I am competent, and you're going to start into a training pathway straight from coming from abroad, and then you're going to be put on a night post on your own, no support. It's going to be quite difficult for you to not only navigate the protocols and the guidelines of the system, but also the hospital electronic systems and the hospital protocols. So it's not advisable. However, it's doable. There are people who do it. And there are some hospitals that are more supportive than others. But just a heads up, I have personally known a few trainees who have done this. They've come from abroad, started a training program here immediately, were taken out of the training program because they did not have the competences of a doctor, of a foundation year doctor, which I will tell you about in a little bit. So they had to be taken out the program, put in a regular post to reprove their competences, and then a few months later they were put back in the training program. But it's a bit of a hassle for you to do that. So it might be better to start in a non-training program, as most international graduates do, and I'll come to discuss that later. Your training pathway, when you start it, at the end of it, the goal is to get a certificate of completion of training, a CCT. What that means is it's just a certificate to say, I'm a consultant now, and you're going to be put on the specialist doctor register, which is a database of all the consultants in the country that's open for public access. Let me briefly go through the training pathway here in the UK. So as usual in all the other countries in the world, you have your medical school years, you finish them. In general, abroad, you do 1 year of internship, and then you go into your specialty training. In the UK, it's a bit different. You have your internship here, that is 2 years, and it's called your foundation years or your foundation program. The foundation program year 1, FY1, is your regular internship like every other place. It's you coming out of medical school, trying to learn the basics of medicine, right? Cannulating, doing bloods. You will not have a full license. You will have like a half a license, a provisional license. So you're not allowed to take any clinical decisions on your own. You will have to work in conjunction with a senior in that. But then in foundation year 2, FY2, you'll move to a full license, a complete license, where you'll have the a license to be able to take decisions on your own. And once you're done your foundation years, you can then start to apply for specialist training. There are 2 pathways for specialist training in the UK. There is what we call the run-through training. That's the top box. What that means is you will start training, you will apply for whatever specialty you want, you will start it, and you will get through all the way till the end, and then you will get your CCT and you become a consultant. This is in contrast to what we call uncoupled training, which means there's a core part, there's core training, which is your first 2 to 3 years of training. When you finish these, you have to reapply for higher specialist training, okay? Only specific specialties have this, not all specialties. And I will link you to resources so you can read up on which training programs are run through and which training programs are uncoupled. Examples of run-through training programs where you start and continue all the way till the end is GP training, pediatrics, ophthalmology, and uncoupled training examples would be anesthetics, internal medicine, surgery, where you have to do a core training and then reapply for whatever subspecialty you want. So there's 2 application processes in this. Let me just see if I've covered everything here. Yes, perfect.
Don't worry, no, you have plenty of time. You have like 10 minutes, so feel free to talk.
Thank you. Wonderful. Okay, I wanted to touch upon something special in the foundation program, which is the what used to be known as the academic foundation program and is now known as the specialized foundation program. Some people might be interested in growing their careers in medicine, in research, in leadership and management, in teaching, not just in clinical, in the clinical aspects of it. And this is what the foundation program allows you to do, the academic foundation program. So you'll be allocated a part of your program to developing these aspects. And then the other part will be allocated to developing your clinical competences. And I've put in a link again to the website for this program, so you can read more about it if you're interested. I think it's a brilliant idea. I think we need more doctors anyway in research, teaching, leadership, management. And this is just to give you a glimpse of only the medical specialties that are available in the UK. This is excluding the surgical specialties. So you can imagine you have a wide breadth of variety here, and you can choose to go into any one of these. Don't let anyone discourage you and tell you that they are too competitive. I've put in the competition ratios as a link in the end of my presentation. So you can click on that and go to it and see what the competition ratios are for each specialty. Regardless of how competitive they are, if you have the requirements, if you have a great portfolio or CV, you can make it. Don't let anyone discourage you. I always tell this to people. The last pathway that I want to discuss is your non-training pathway, or your non-training jobs and posts. So you can apply for these non-training pathways and posts after passing your PLAB 2 while awaiting your GMC registration. And it's super flexible. You have many options. The non-training pathway, again, you can do this when you want to start out in the NHS, you want experience, you can apply for this to begin with and then go from a non-training post after like 6 months or a year into a training post. Or if you are someone who is a consultant in your country and you don't want to go through training again, you can go through what we call the CSER pathway, which is a non-training pathway, and I'll discuss that in the next slide. Or, for any reason, you have personal life circumstances that you cannot go into training pathway for. You can go into a non-training job. The very confusing thing about training jobs is you have so many terms for it. When you go to apply on the NHS website, there's many different terms that mean the exact same thing. And if you don't know what they are, you won't know what the difference is. And you can get confused as to what you're applying for. So the main purpose of the slide is to sort of delineate the different terms that there are and tell you what is the same thing as each other, what's synonymous, and what isn't. So these are called non-training pathway jobs, or in other terms called trust grade jobs, okay? Or your clinical fellowships. And you have a junior clinical fellowship and you have a senior clinical fellowship. Your junior clinical fellowship is also otherwise known as an FY2 equivalent or a foundation year 2 equivalent. a CT1 equivalent. A CT is a core trainee, what we discussed before about the uncoupled training pathway, and an ST1 equivalent. ST1 is for the run-through training pathways, or senior house officer. These all mean the exact same thing. Whichever one of these you see on a job advert, they're the same. And this level is your junior doctor level. So these are the doctors who are in their first few years of training, and they're before the registrar years of training. But again, this is the non-training, so they're equivalent to the junior training years.
No,
and then
you've got 5 minutes, darling. 5 minutes.
Thank you. And you have your senior clinical fellow, which is also synonymous with your registrar level or your SPR, which stands for specialist registrar level. Your senior clinical fellow, registrar, SPR, they're all the same thing to say you are at a level of competence of a higher specialty trainee or a trainee within their final few years of training. So you need to be careful when applying for these jobs, because if you're coming straight out of med school and you've just finished your internship, you don't want to apply for a senior registrar post. That's very dangerous. You're going to put your license at risk because you're going to take on heavy duty clinical decision making at that level. And if you're coming from your country and you're a specialist in your country, you don't want to apply for a junior clinical fellow post, possibly, because you're overqualified for that. So that's where the two distinctions come in. I've put a link again to the non-training jobs website. There's a lot more information on there, and that's where you apply, basically, and where you see the advertisements. So your Caesar pathway, I've mentioned it in the previous slide, and this is for people who they start in a non-training pathway. They don't want to go to a training pathway for whatever reason, but they still want to become a consultant. They still want to progress, because if you're in a non-training pathway, it doesn't mean that you cannot progress to a consultant. There is a way, and that is your Caesar route, which is your certificate of eligibility for specialist registration. It's a mouthful. This is your equivalent to the CCT in the training pathway. So once you apply, you submit an application for a Caesar, you will be eligible to be put on the specialty register of the GMC. That means you can be a consultant. It's, again, a process here in the UK designed for doctors who've not completed a UK training program and who still want to be recognized as consultants. These can be doctors who've trained outside the UK or doctors in non-training UK posts. That means if you're outside of the UK, a consultant or a specialist, and you want to become a consultant here, you can do through the Caesar pathway. You just need to, again, compile a portfolio of evidence to prove this based on the requirements of the GMC. And I believe I've linked the Caesar link to the GMC website, which, you know, delineates the application process and the requirements for it. Requirements could be things like logbooks of cases, if you're a surgeon, logbooks of surgeries, research publications, evidence of clinical competences, and these can be from here or from abroad. Yeah, that would be that. I wanted to mention something about the Caesar pathway. Completely flew out of my mind. Let me see if I remember it towards the end. Oh, right. Caesar pathway might not be something that is accepted outside the UK. So please, if your goals are not to remain in the UK long term and you want to move to another country or back to Iraq, make sure to look into whether or not the Caesar pathway is accepted in wherever you want to move to. Because not all countries accept a Caesar pathway, but all countries accept the CCT pathway, the training pathway. And these are resources I've linked in that you can click on, take a screenshot if you want, or again, put your email in the chat box and I'll send it to you at the end of this. These are the blogs that I told you about and the Facebook group, which you can join. You can feel free to ask questions A to Z about about your journey in the UK. Don't feel embarrassed. You can post anonymously. But before you post, maybe search the group or search the blogs about your question, because you might find the answer. And that's it. I hope it was helpful.
Thank you, Noor. Very lovely. Oh, you got it. You got it. Thank you, Noor. You can stop share. It's very lovely presentation, full of information really for everybody. So I'm pretty sure everybody would be delighted with what they heard, you know. Now we got our last speaker, Dr. Marwa Saleh. Nice to see you, Marwa. And I just wanted to introduce people to you because you sent us a few things about yourself. Marwa is an MD graduate from Oman Medical College. She also holds a baccalaureate and master degree in cellular and molecular biology from Canada, University of Calgary. She completed the PLAB route and obtained her GMC registration in 2021. She's interested in pediatrics? Good, because Dr. Majid Jawad, he's around. He can give you a hint about how to pursue that because he's a pediatrician or a GP, so you want either this or that. And she has an experience as a pediatric SHO in the NHS and currently work as a bank doctor in emergency medicine. Okay, well, we're very glad to see you because you slightly came late, but now the platform for you, start sharing your document and give us your talk. Thank you.
Yes. Can you see my document?
Not yet.
Not yet. Just
Marwa, share screen, the green button.
yes. Yeah. Okay.
Have you opened it in your? Let me just make sure you are a co-host. Are you
Yes.
co-host? Yes, you're a co-host.
Now,
Absolutely.
now it's clear.
Yeah, it's good.
Okay.
Oh, Dr. Majid is around. Okay, he's Majid around. Yeah, good. Yeah. So yeah, start.
Good evening, everyone. My name is Marwa Saleh. I prepared lots of slides about what my colleagues have already talked about. So I guess I'll go through them very quickly because most of these topics have been already covered or explained. And that will make it faster, I guess, to progress to the Q&A. I was going to cover my journey about how I got my GMC registration and in general, how you can acquire GMC registration. But I believe one of my colleagues have covered that. So just to go in summary, in order for you to obtain GMC registration, you would have to finish the PLAB exams, or there is the MRCS or the full MRCP pathway as well. I will share my story because I got my GMC through the PLAB pathway. And then you will have to obviously give the evidence of your primary medical qualification. And then you would have to do the EPIC certification of that. And then you would have to have an evidence of your internship, demonstration of English knowledge, and that would be either through the IELTS route or the OET. You have to have a valid passport, certificate of good standing, and you will need to cover also the activities in the past 5 years, and even if you had gaps or educational courses. And then eventually you would have to declare your fitness to practice in the application, and all your documentations have to be translated in English. In terms of PLAB 1, I saw a few questions about resources and if they want us to give advice. In this presentation, there is no way of advertising any particular resource, but I would tell you what I actually did, and I think my other colleague also talked about it. So PLAB 1 exam is it's basically a written exam. with multiple choice questions, 180 questions. What matters is it's a pass or fail exam. So it doesn't matter what kind of grade you get. I personally used PLABable. I did the questions on the bank, and I was ready for the exam and passed it from the first try. There is other resources like Pass Test, and I think my colleague also covered the IMG group on Facebook. They would also be helpful a lot to give you other resources and in relation to that test. And then the next step would be doing PLAB 2. That's an OSCE exam with 16 stations. Minimum pass would be to pass at least in 10 stations for you to pass that exam. And again, it's a pass or fail. So if you passed, congratulations, you move on to your GMC registration. In terms of resources, there's lots of resources nowadays. Before, it used to be the classic of going into teaching academies and doing these academies actually in UK, so traveling all the way. Nowadays, you can do online courses, you can do self-study, group practice, etc. So in terms of my journey, I did the IELTS exam. I was lucky enough to that was before the OET was available for GMC registration. I was lucky enough to pass the exam from the first try, and then I applied for my PLAB exam. Because I was studying in Oman, the closest location was to go to Dubai and complete the exam. And then as soon as we found out that we passed the PLAB 1 exam, we started preparing to travel and do PLAB 2. As I said, the classic way, and as we learned from also previous colleagues and what they advised us, is to go through an academy. We did Common Stations, which is one of the academies that offer practice to the PLAB exam, and it was in London. It was a very intense course. It's 2 weeks for 14 days. Back to back, so no breaks, 12-hour course daily. And then it is depending on the I would say the visa length that you get, or your financial status, how long you could stay in London, you can book your PLAB exam afterwards. For us, because we were working back in Oman as a GP, we were only having 28 days of vacation days, and we used it all for the exam. So literally we had 2 weeks of the Common Stations practice, and then we booked our exam almost 10 days right after the academy. For us, it worked that way because the intensity of the course made the knowledge still fresh in our head, and then we were able to go in the exam right away. A lot of people, my advice against that is that have at least a month to digest all the information that you learned in the academy and then do the exam. It's up to you. As I said, depends on your situation and the time that you have. And then luckily enough, we after these 2 weeks, in those 10 days, we had a group of friends and we were practicing together using all of the resources also that came with the academy, like after hours access to the SIMMAN and the other things that you can use. And then we traveled to Manchester to do PLAB 2 examination, and then luckily enough we passed that exam. And I think in my time I had the pandemic situation, so that kind of delayed a lot of paperwork issues that led to the delay of me getting my GMC. So PLAB exam was done in 2019. I obtained my GMC in May 2021. And then and then my husband is also a doctor. He got a job, non-trainee, junior clinical fellow in medicine in the UK, and that's how we moved from Oman to UK. That gave me the luxury of being on a dependent visa, so I didn't have to be on a full-time job, which I think my colleague covered locums, and I can give you my experience in that for anyone who's going to come on a dependent visa. With another person who is actually having to do the requirements for the skilled worker visa. So I'm interested in pediatrics, as it was mentioned in the introduction. So I I really wanted the job in pediatrics. I didn't want to do just any NHS job to get my foot in. So because I said I had the luxury, I was on a dependent visa and I was able to stay in the country. So what I encourage a lot of people, if they have that ability, is to do a clinical attachment, because that's what I did. I emailed, I think, every single consultant in the hospital that my husband working at in the Department of Pediatrics. And then I started getting random replies and one person referring me to the other until I was able to land myself an observership or a clinical attachment in the pediatric department. Within 3 weeks, they told me, why not apply for a post? I guess if you work hard, if you come on time, if you show work ethic, real interest in the field, and exactly what you used to do in your internship, then they will see that you will demonstrate your knowledge and clinical skills. And then sometimes I've heard even in hospitals, they create the job for you. Maybe that sounds too optimistic, but that can happen, is that they actually open up an application on NHS jobs, and then you apply and you would be one of the candidates to be considered because they have seen you. And that's kind of the case that happened with me. And I applied, I went through an interview process, and I got a job. While I was on that job, I got pregnant, and then I went on maternity leave. From the maternity leave, I didn't want to go back to a full-time job due to childcare and whatnot. And currently I'm a locum doctor. So for locums, if anyone is interested, as I said, if you are one of those who will come on a dependent visa, you can choose to work how many days, what kind of hours, what specialty you want in. The only drawback for me, I guess, because I live currently in Bristol, I only have 2 to 3 hospital options that I can apply to. Currently, the locum opportunities have been a lot less than it was before, so it's quite competitive. But it works for me because I don't need a full-time locum. I want to do 2 to 3 days a week maximum. And that's what I've been doing. I wasn't lucky enough to land in pediatrics because there are none in Bristol, but currently I'm just locuming in emergency, medicine, oncology, and different subspecialties. And I work according to my own schedule. And that has worked for me fine. And it did not propose any challenges in terms of GMC registration and revalidation so far. I'm hoping to apply for training this cycle to pediatrics. And as I said, and an ORGP, because as many of us know, as an IMG or international medical graduates, we always have to have that backup option, because maybe in relation to our education, experience, or a bit shaky on our confidence, we always have to have a backup option. And that's why I'd like to apply for another specialty, because if that didn't work out, at least I can consider the other path, either or. So that ends the summary of my journey. I just wanted to cover something new that probably, I don't want to shock anyone or scare anyone, but in case you hear that, I don't want you to be scared. So UK MLA will be starting in 2024. So that's actually really soon. It sounds like the other countries, like the USMLA. So, and I believe other European countries also use that format. For people who have already booked a PLAB exam in the 2024, it's not going to change anything. I put this in my presentation just so that if anyone started to hear here and there about UK MLA, I don't want you to be scared or to freak out. UK MLA is actually exactly same as PLAB. It's a matter of changing the format of the exam, and not necessarily the format, the domains that it covers, which I will put it in my next slide, and the naming of the exam, and few of the yeah, I would say the format of the exam in general. So PLAB 1 would be basically exactly similar as the knowledge test, so the AKT part of the MLA, and PLAB 2 would be exactly as the clinical and professional skills assessment, so the CPSA part of the UK MLA. They said on the, you can get more information, of course, about UK MLA on the GMC website. They said that anyone who has booked an exam in 2024, they will get at least 3 months notice and email before the exam name to be changed, or if any format or anything needs to be changed. However,
Marwa, are you doing it on purpose because you're not moving your slides? Or why your slides are not moving?
really?
Yeah, we're still on the my journey.
Really? Okay. Do you see that one?
Yeah, no, just share whenever you do PowerPoint, there is a special. Yeah, no, now we lost everything.
Yeah,
We
I
got-
wanted to.
Yeah, well, you talked legibly and nicely. Now you can go slide by slide,
Okay.
and you don't have much more minutes left really, because you spent
Yes, that's almost that's almost the end of my slides. Actually, I just wanted to touch on the UK MLA part, just so that nobody is, as I said, nobody's scared about it. I put in brackets here, UK MLA is exactly equal to PLAB. So not exactly, the format will change, but I mean, it in terms of legibility requirements or application wise, it's exactly the same. It's a matter for us as an international medical graduate, it will be changed in the format and the name. It will cover the 6 main domains, which some of it will be was touched upon in PLAB 1, but this is going to be more thorough in terms of resources. As far as I understood so far, PLABable resources, PLAB examination resources will be enough to prepare for the UK MLA.
Yeah, you got 5 more minutes if you want to use it,
And that
no,
would be the
Q&A,
end.
No, the Q&A, we leave it till the end anyway. If you finish, that's fine. Thank you very much, Mo. Very nice of you, really. And definitely, but when the things finish, you get to speak to Dr. Majid Jawad, and I'm pretty sure he would give you a few tips about how to pursue a career in pediatrics. Now we come into our keynote speaker, Prof. Rahim Haloub. Prof. Haloub, are you around? Are you there? I made you a co-host so that you can. Are you around? Just not make me sure you're there.
I am around, actually.
Okay, good, brilliant. So let me just introduce Prof. Haloub to you. He's a well-known obs and gynae specialist, and he's a fertility specialist. In fact, he has a long record as being a teacher for both undergraduate and postgraduate. And currently he's a professor in obstetrics and gynecology. And he is engaged heavily in training Iraqis, both back home and here. And he got huge experience. At one stage, he was the PLAB examiner. And that's why we invited him today, just to give you tips from his perspective on how to pass this exam first and what to do afterwards. Prof. Haloub, the platform is for you.
Thank you very much, Ali. Very kind of you and very nice introduction. I think probably there are a lot of things actually covered by many of the people who spoke before me. And am I sharing now or?
We cannot see anything yet, Prof. Haloub.
If you just see anything, okay. Well, let me have a look at that one, because.
Are you from a laptop or a mobile?
I have a laptop.
Okay,
let me share that one first, and then it will be done. What about now?
Yes, now we are in. Yeah, absolutely.
Okay. Right. Well, basically, I'm just going to talk about my experience with the General Medical Council and their exam for many years. I think whatever said about the preparation and how to do it, it is true, but probably there are huge variability, meaning that depending on how they prepare you, basically. And I remember we have to prepare ourselves as examiner, and that means we have to have training how to judge the junior doctor to be a doctor in the UK. And one time we have a video, a live video, which was actually recorded during the PLAB, and they show us a good candidate and a bad one. A good candidate who can actually pass the PLAB without any problem, and it happened that she was actually an Iraqi graduate, which is very interesting. Anyway, so I'm going to run through the how to judge the competency of a doctor, and it sounds very complicated, but I think it is not. But we need to understand the PLAB. What is the PLAB? What do they want? What do they want? And they want you to have actually the right knowledge and skill to practice in the UK. Now, and we have to judge that one, and we have to certify you to find out whether you can actually fit in, and in a foundational program training, and basically that's very important. And how you're going to be able to do it? You have to have a professional value and behavior required for a normal doctor. What they say the normal doctor, meaning that a British graduate, a normal doctor for them, of course. It's very important actually for us to view you as an overseas graduate and compare you to how the British doctor, British graduate behave and conduct their duty as a junior doctor at the beginning. In order to provide excellent care for your patients. And that's very, very important. And now, the problem now, how do we actually define excellent care for your patient? And there are many domains to identify that kind of thing. And therefore, they devise the PLAB test. And the PLAB, like you mentioned, part 1 and part 2. Part 1 is the medical knowledge, meaning that multiple choice question, and part 2 is the one which is going to judge you actually more than the multiple choice question. So therefore, the what is the PLAB covering? The knowledge, skills, and behavior. Okay, and what is the knowledge, skills, and behavior? That means that good medical practice, outcome for provisional registered doctor, you have to be familiar with. Good medical practice is actually like a booklet issued by the GMC, and you have to be familiar with it. That is very, very important document you need to be familiar with, because that will shape your personality. And that's very important to shape your personality in order to introduce yourself to the PLAB test. And there's another document, outcome for professionally registered doctor. And again, you have to be familiar with the requirement of the UK Foundational Program Curriculum, which is published in 2021. So these are documents will help you to shape yourself and come to the PLAB with this knowledge in your mind in order to behave like a good practitioner. Now, good medical practice is very important actually document, not only for junior doctor, but for everyone, for us. And that's very important. And they described that what is the meaning for good doctor? Make the care of your patient your first priority and concern. And that's very important. That means you have detached yourself from everything which might actually influence a doctor who is not well prepared, meaning that you have to avoid entering into any discrimination in terms of the gender, in terms of the nationality, in terms of color, anything and everything. So therefore, your concern is a patient in front of you, whether she is black and white, whether she is a lady or a man, a child, whether it is mentally handicapped or whatever. So you have to consider the patient as a patient, and that is your main, and that's very important. Okay, now you have to be competent to do it, and competency meaning that it's not only by talking. Remember that sometimes you might actually talk very well, but you are not reaching your target at all, and that we can actually judge it because there are a lot of people who might come to the PLAB and master the language, okay, and trying to project that one to you, okay, in order to dominate that meeting. But when you come to the actual knowledge, medical knowledge, behavior, and all that kind of thing, you are not actually well prepared for it. So therefore, very important that you have to have mixed bag, which is the knowledge, the skill, and the language, of course, because you have to pass the language before you come to the PLAB. And not only that, but you have to skill yourself with the prompt action. What is the prompt action? Prompt action is when you are facing a patient with a problem which needs your intervention, okay, your intervention to probably save life or make a priority treatment or intervention. This is actually prompt action, meaning that you have to have your knowledge there, you have to have your skill there, you have to have your interaction and with the patient and her family or his family, and therefore you have to build like a good partnership, and good partnership not only with the patient, but you might actually require help from a team around you. That means teamwork. It's very important, and you have to be open with the patient. Open meaning that you have to tell the patient everything in your mind in order to make sure that the patient will understand you. And that's very important. So you are actually building a bridge between you and the patient in order to facilitate your intervention or anything you are going to do in the future. So therefore, you have to be open, you have to be honest, and you conduct your duty with integrity. And that's very, very important for the doctor, whether you are a junior or a senior doctor. Now, in order to obtain trust of your patient, you have to show all these things which we actually talk about it, and the patient will judge you from maybe the first meeting when you are very concerned about the patient and trying to show that you are helping him or her in order to get through her problem, which might be a major problem, it might be a minor problem. Now, therefore, you talk about the two parts of the PLAB, and of course, the format of the multiple choice question. You are going to choose out of the scenario. You have to choose one right answer from 5 possible answers. And of course, you have, as you said, with regard to the part 1, you can set it anywhere. Appointed by the GMC. However, the PLAB 2, you have to sit it actually in the UK, and there are actually few centers around in London, Manchester, Cardiff, Edinburgh, a lot of centers around UK. Right, okay, what does it involve? And these are very important. It actually covered everything the UK trained doctor might expect to see for a doctor coming to the ward facing the patient on day 1. And therefore, the level of that should be actually level what we call it foundation year 2. And you have to be able to apply the knowledge you acquired from your training. And it's very important that application of knowledge not how well you can remember and recite fact, meaning that you could be knowledgeable. You could actually remember the textbook you read and the page you read and whereabout in the page, but how you actually reflect that one and use that knowledge to help the patient, that's different. So therefore, this is actually what we call it applied knowledge. Applied knowledge meaning in the right time, at the right moment, and in the right way for the right patient. These are very important because there are huge variability. And of course, there are other things you have to be familiar with. Remember that there's a British National Formulary, and you have to be very familiar with BNF. Because part of the PLAB might be a prescription or a drug or drug charts to talk about it maybe and how to fill it. And therefore you have to remember the format and how you actually write it down, and you have to write it in a way that can be read by ordinary person, basically, especially when to go to the pharmacy, and the writing in terms of the name of the drug and the date of the prescription, time of the prescription, who is going to give it, and the dose and the right milligram or microgram or whatever. And all that actually you can look at it in the blueprint of the PLAB. Right, what will scenario look like? Now you have a scenario. You are coming to the PLAB to do it, and you have 16 stations, and each station might be different. Now, if you look at the people, how the people actually coming to, there are a few stations, different station with like sometime you have a station you do in front of your examiner. There is another station you can actually talk to the role play, and there's a station with the interaction with the consultant in charge of that station. Okay, and then you have to be familiar with the format of the station. However, when you read, you have 1 minute or 2 minutes to read outside before coming into the station. They will tell you that you are a foundation year 2 doctor, like in general practice. Like I will give you an example. You are told that your patient, James Horton, age 45, has called to complain of pain in the head. You are not giving any other information. You must assess and manage the patient over the telephone. You will be given 8 minutes to complete the scenario. Now, how are we going to do that with only one information given to you? You have to open doors. You have to open doors. You have to think about, you have to use your knowledge and apply it. Here we are. Now, how do you do that one? You do it by like you are talking to a patient facing you, meaning that the examiner wants you to see to demonstrate to him the behavior you are talking to the patient. That's very important. And in order to get more information from the patient, because you are not actually having any information apart from the headache. So therefore, you have to think about how we gather the information, okay? And you need the skill to talk to the patient in order to gather more information from him in order to apply your knowledge then to treat him or to provide him with any type of treatment, whether medical treatment or asymptomatic or whatever. Now, so that's very important, that the examiner wanted you to extract that kind of thing, to gather information. That's very important. And then use that information as something to try to format or to make a plan for the management of this patient. And you have to have something called interpersonal skill, not with your colleague only, but with your patient, in order to get more information to help you to solve the problem. So what will you need to demonstrate to us? Take a history from that person who is on the other side of the telephone, okay? And therefore to ask them about the location, the exact location, the duration, the trigger for the pain, associated symptom, whether there's a problem, blurred vision, or whatever you think that's appropriate to ask. Take a medical history. It's very important whether he is on medication or maybe he had some trauma. Find out appropriate lifestyle, maybe alcohol. He's maybe taking alcohol, excessive alcohol, or maybe certain diet or allergy or whatever. And listen to the patient. When you ask the question, you have to give the patient time in order to get these message through to you in order to analyze it and show empathy. That's very, very important. By looking at these things and you give a leading question, meaning that to remind patient about the condition he associated with headache, but patient don't actually remember, or maybe the patient under pressure because facing a doctor on the telephone. Then gathering this information, you have to make a diagnosis of possible maybe migraine and recommend appropriate management. And you have to conduct the consultation fluently and professionally, meaning that no hesitation, no or whatever, and you have to be direct to the patient. And if you are not able to solve the problem, you have to be honest. You have to tell the patient that, well, look, basically, I don't know what's the problem, and my feeling is I need to talk to my maybe senior to maybe discuss the case, and we might come back to you or make a recommendation for investigation. So therefore, meaning the fact that you have a patient in front of you, that does not mean that you are going to plan the management. You might actually need input from other people also, and there's no problem at all to tell the patient that, well, look, I need to have a chat with my consultant, or I need to have a chat with my registrar, or I need to have a chat with my colleague who is probably more experienced than you because he actually started the job before you. Therefore, that will be appreciated by the patient, because the patient then will understand that you are caring, because you can actually give her anything, or him anything to go, just like a painkiller or a paracetamol or whatever for headache. But the fact that you admitted that probably he gathered enough information about the patient, but he cannot actually put a final diagnosis in order to manage the condition of the headache. So therefore, if you tell him that, well, look, I need to have a chat, he will be delighted, because you are showing a very important role of a doctor to use all the opportunities to help the patient. Remember that the center of your concern is the patient, and you have to show it. Okay, now, so what are we going to do? What about safety and quality? And that's very important. And I thought probably we instead of actually talking about that, I'm going to give you like a case. How the limited knowledge require you to go beyond your capacity and go to get more and gather more information in order to help your patient. So therefore, there is one patient who is 35 years old, lady admitted for vaginal repair. The operation carried out by the consultant. You are foundation year 2 doctor in gynecology. You were assisting him. You are in theater. The procedure was complicated with intraoperative bleeding. So you know that the patient, the procedure, not very straightforward repair operation because complicated by bleeding. Your consultant was due to fly to another country in 3 hours' time. And you had a call from the recovery in theater. So therefore, after about 2 hours, the patient still in theater, which is very unusual because the patient normally, uncomplicated procedure should be probably about 20 minutes to half an hour if there's a problem, a minor problem, before the patient go to the ward. But after 2 hours, ask you to see the patient, and as she has very severe pain in the pelvis and the back. The question now, you know that the consultant is not there, and therefore, what would you do on the first spot? That means you have to take immediate action. You remember I mentioned that before, in order to relieve the stress of the patient now. So therefore, the priority now is to help, how to help the patient now, okay? And then think about what else can I do in order to reach a diagnosis and help the patient, okay? And so what you do? So in that case, you have to make sure that number one, you have to treat her pain. Basically, that's the immediate thing. Okay. Now, after full examination, because she's in the recovery, you have to inquire about the blood pressure, the pulse, the vital signs. You examine the patient, make sure that you are looking at any bleeding down below, abdominal palpation, all that kind of thing. Give her analgesia. And if you think that there are no major problem, and you can actually assess the patient after your prescription for pain relief. Pain relief may be more than the one given before. And therefore, you could say that, okay, fine. Well, in that case, I will probably talk to my senior. But if there is nobody there, you have to make sure that you have to ask for who is covering your consultant when he is away. So you should know that when the consultant away or going to be away, there somebody should be covering him, especially for a consultant going out abroad immediately after or within 3 hours after an operation. However, so what you do then, try to, because the consultant told you that he has to leave in 3 hours, and now it's about 2 hours gone, and therefore give him a ring and find out what happened. So therefore,
Rahim, you got 3 minutes, please.
3 minutes. Okay, give him a ring and find out who's covering him, and therefore you can contact the cover and get instruction from him. Safety and dignity. This is another case. Your consultant asked you to see Amanda Dooley, who is a 22 weeks gestation in antenatal clinic. While you are reading her notes, she informed you that she just had a second scan, which showed some abnormality finding. Of course, what is the immediate action? If you are concerned, of course, you should be concerned about the patient. Then you have to find out what kind of abnormality. And in that case, because you are a junior doctor foundation year 2, this matter is a very complicated matter. You have to refer to your registrar or the consultant in order to get the plan from them to find out how you're going to help this patient. Therefore, you have to know that you are dealing with the safety here measure in order to avoid major problem for that particular patient. Communication and partnership and teamwork here is very important to conduct your duty. Treat the patient as individual and respect their dignity. and treat patient politely, and you have to be very gentle with approaching thing and raising issues. Respect patient right to confidentiality, very important, meaning that don't actually leave the door open, meaning that if anyone enter the room, you have to stop and get permission from the patient. Or if somebody wanted to join you in consultation, you have to get permission from the patient. Listen to the patient and respond to her concern or his concern. Give the patient information, very important. Information given, meaning that you have to give information, vocal information, you have to give written information, you have to give video, or you have to instruct her to go to like a website to get more information about her condition. Work with colleagues in the way that you benefit for the benefit of the patient, very important, and always go to senior colleague in order to get more information and clarification of a very difficult situation. Now, the last one here is very quickly, you are foundation year 2 in general practice, and you are asked to convey result of abnormal cervical smear to a 34 years old Hakima Kafala, who does not speak English. She came accompanied by her husband, who can communicate with her in her language. Explain the result, plan for the management, and write a letter to the of the referral to the colposcopy clinic. However, the problem here, very simple, you cannot use her husband as interpreter. Therefore, you have to make sure that you have to get interpreter either face-to-face or on the telephone in order to make sure that the information delivered to the patient, not to her husband, to the patient. And that's very important. And after that, think about you have to explain the result through the interpreter and give her plan of management and write a letter of referral. Now, the last slide, maintain the trust, be honest and open and act with integrity. Never discriminate unfairly against patient or colleagues. Never abuse your patient trust in you or the public trust in the profession. You are personally accountable for your professional practice and must always be prepared to justify your decision. The fact that you are a junior, nobody will defend your decision. I will give you an example, very short one for 1 minute. A patient who had a major operation and was complicated by severe bleeding, okay, and she had multiple myomectomy, and before she had many laparotomies before, she required a lot of blood transfusion. She was in hospital for about nearly 2 weeks, okay? The junior doctor who actually discharged her without anticoagulation. That is why discharge her without anticoagulation, because she did not consult the consultant on call on that day or the in charge of the consultant in order to tell him that, well, look, this is actually a complicated case beyond my knowledge, and therefore, please, can you help me? That lady was discharged without anticoagulation, and she died 3 days at home with severe pulmonary embolism. That doctor is facing the coroner, and she has to explain her action or lack of action. Thank you very much.
Thank you, Rahim. Thank you very much for this lovely presentation with many, many messages to our junior doctors. And medicine is always very interesting, really, subject, and then there is always possibility of getting things wrong. But as you say, for juniors, even though they are protected by the hierarchy, that doesn't mean they are not accountable. Now I'm coming just to ask Dr. Majid Jawad, he's the vice president of our organization, to give you a few words of his wisdom and also to share with you a few things out of his very long history of being an examiner to the undergraduate and the postgraduate student. Dr. Majid, you have 3-4 minutes, maybe 5 minutes for you. Thank you.
Thank you very much. Thank you very much, Ali. I'm sorry for the 5 minutes belated joining because the link didn't work. I didn't want to disturb the proceedings. Anyway, I listened to all presentation. Firstly, thank you very much, Ali, for preparing this and I hope it will help our junior doctors from all over from overseas. I'm not gonna say to Iraq only, all Arabs and elsewhere in Middle East and MENA region. And thanks for Professor Halub for his great contribution and for our lovely juniors presentations, namely Zain, Hassan, Noor and Marwa, and I think for the input of Islam, okay, pre-input preparation. Now I'm not going to regurgitate what they said. They've said a lot, and there was some repetition, which is very useful indeed for reminder. Okay, I just would like to stress a couple of things very important for our juniors who come to UK. Firstly, whether the old PLAB or the new PLAB that Marwa referred to, the UK MAL, okay, there is a stress. One of two stations on the old one and the new one area out of the 6 on mental health. Now, this is not something usually practiced by our juniors elsewhere, and they have to be aware of when they come, and then we can give them examples in the future. That's one thing, okay, because it is important. They don't normally practice it regularly if they are in surgery, obs-gynae, pediatric, etc., but they still have these. They have to be aware of this, and they have to be equipped. The other area is equality and diversity, and that's what our good Professor Halub referred to when he said you put the patients first, and also you respect the dignity and the confidentiality and other things. Equality and diversity is a very, very important area, and that's treating everybody, whether patient or colleagues, regardless the race, sex, age, disability, etc. So they have to be aware of this thing. Very important. The third important area they don't know, the juniors when they come to this country need to stress on is safeguarding, whether children or adults. And they don't know, they don't practice this a lot abroad. And they might be asked and cornered, and in some cases, when you have a child abuse, well, that's an old terminology. They call it child protection or safeguarding, or domestic abuse, where, an adult, a female or a male even, or indeed, a husband or a woman or a girlfriend subject to abuse. Okay, so they need to know about these things, because these are very important areas candidates fail on, because that's a feedback come to us from our trainees, you see. And I thought I will just flag it to our doctors. I'm not going to go through any details because we have no time for this. Yes, and my area very much is postgraduate, and for postgraduate we're going to allocate a whole session for this, just like this lovely session prepared by Professor Ali Nakhash, okay? And we may even ask Professor Ali and Professor Halub within their own remit and specialties, okay? Because this is a very important for those who comes to here seeking further training and gaining expertise, Western expertise, okay? And there are two types of visas, Tier 2 and Tier 5. Tier 2, where they have the either through the MTI, which is Medical Training Initiative, and they must have the PLAB or MRCOG or MRCS or MRCP or MRCPCH in order to be exempt from PLAB and apply for this route, so that they can go on the either trust doctors or join the training initiative in the future. We will go in more details on this when we have a session for this. This is a long story, okay? But it's very important, as also Professor Haloub mentioned, areas, you know, that junior doctors, when they sit the PLAB or any exam, their enemy and the Middle Eastern enemy is that when they pretend knowledge, never pretend knowledge, and never be hesitant to share the knowledge with your seniors or colleagues. And that's when they love you. Okay, the examiners, they say, he is a safe person. He is an honest person. Okay, yeah, you know, he doesn't pretend, or he or she, that they are the only person in the whole world knows these things. They will seek advice from a senior gynecologist, a pediatrician, a rheumatologist, an anesthetist, etc., etc. Okay, and also when they respect the confidentiality and diversity and equality, and of course, you know, the dignity of the patients. I'm not going to go further on this because I think it's been well said by all our present speakers, who are very grateful to them. But we will arrange a postgraduate one for the postgraduate training, whether in various disciplines, pediatrics, obs and gynae, surgery, and I think we should, it's worth to do a whole webinar on this, okay?
Absolutely. I agree. Thank you, Dr. Majid. Thank you very much for these very wise words to everybody, really, including us. And now we come into the last session, which is the Q&A. Please, Islam, take over now and go through the Q&A session.
Okay. Thank you.
Breaking up.
Hey, who will internet?
Hi everyone.
Yes.
So my name is Islam. I'm one of the urology trainees in the Wessex Deanery. Great presentations. My internet is not great, but I just want to say great presentations by everyone. And thank you, 10 points. Always be safe. These people here love talking about with my registrar, or I will check with my senior and I'll let you know. And I remember one of the stations, that's what I said, and it is important to just be safe. And we'll go now to the Q&As. And there is a question, probably Noor would help with that. 6 months after graduation, before GMC, is it considering a gap? Whether it's Noor or Zain or Hassan or Marwa?
Yeah. The question is saying 6 months after graduation?
Yes, so 6 months after graduation, right? Before obtaining
this is not a gap. Usually for Iraqis doctors, when we graduate, we have up to 1 or 1.5 years where we can say that we're waiting for employment in Iraqi Ministry of Health governmental hospitals, and this gap is totally accepted. GMC is aware of this, so it's totally okay to have a gap after graduation until 1 year or 1.5 years. But the gap that is not acceptable is if you're working without the Iraqi Medical Association license to practice. يعني إذا أنت منتمي للنقابة ماكو مشكلة. إذا تشتغل بدون انتماء للنقابة هاي الجاب اللي عندهم مشكلة بها GMC. Otherwise everything is okay.
زين اكو سؤال ثاني تعقيبا على الإراقي Medical Association. There is a question which says my Iraqi Medical Association is invalid and I did not renew it. And I'm already had my PLAB 1. Is that a problem?
No, it's not a problem. It doesn't matter. عادي تقدر ما تقدر انه ما تجدد الهوية مالتك لما توصل للجي ام سي ريجستريشن وتقدم على الجي ام سي ريجستريشن تسوي تجديد للهوية مال النقابة مالتك تدفع الأجور مال السنوات السابقة. It's totally fine. It's not a problem at all.
All right. There is a question from Ahmed. Probably I think Noor can help with this. Is like, does an SHO in family medicine would ever help if you intend to apply for GP? Because Noor, you're a GP
So
trainee.
Ahmed asked me this in the direct messages, and I've responded directly. He has clarified that he means SHO in family medicine in Iraq, because I explained to him there is no such thing as SHO in GP in the UK. GP is equivalent to family medicine abroad. GP is the only pathway in the UK where you cannot get through a non-training pathway into it. There are no SHO posts, there are no non-training posts in GP. You can only get through a training pathway to CCT. And also, it doesn't matter if you've had previous experience in family medicine abroad, because when you apply to GP, the only thing that matters, the only criteria is your grade in the MSRA exam. And I've sent him a link to that exam. If anyone's listening and you want a link, let me just reshare it for everybody. So obviously it helps if you have experience in family medicine, because you can use it clinically. But again, in Iraq, I'm guessing family medicine is very different to GP here. Consultations in GP here are very socio-economically focused, and outside Iraq and outside the rest of outside the UK, they're usually clinically focused, but that's not the case here. So even if you do have experience from there, it might not be as applicable here. Hope that helps.
All right. Thank you very much, Noor. There is another question which says, bank accounts, should it be an Iraqi bank or a UK bank? I think that doesn't make a difference, does it?
It doesn't make a difference. You can have an Iraqi dinar, or in the end, they will turn it into a pound. The officer of the UKVI will just convert it into Great British pounds and see how much it does. So it doesn't matter.
Okay. All right. So the next question would be probably directed at each one of you. So what resources would you suggest for PLAB 2? So Zain, if you can just recap, you might have said in your session what resources that you used exactly for PLAB 2. So did you use a course, and whether you did an online course or any other book or anything like that?
Yeah, the PLAB 2 exam is a very, very vast exam when you can use a lot of resources. For me personally, I've used Aspire Notes, and I've went to Sophia Academy. There is different academies. It doesn't matter if you don't go to any academy at all. The thing is, if you study hard, if you have a good partner to practice with, if you study the structure, if you have a good approach, then you can even pass PLAB 2 without even go to an academy. But if you think that you want to go to an academy, there is different types of academies. There is Samsung, there is Subhi, there is PLAB 2 Guide, there's Aurora's, there's different. This is like a very vast subject. But yeah, I would recommend, if you want to read something, you can either go to Samsung Notes or Aspire Notes. They're really useful resources for PLAB 2. But again, it's a very vast subject, sorry.
That's fine. What about Hassan? Hassan, شو درست للبلاب؟
I studied only a course. I took Subhi. It was very useful, especially the mock, and yeah, I mean, practice. Basically, it will help you to practice. I mean, you can study notes anywhere, but you need someone to practice with, someone to correct you when you have any mistake, someone with experience. So basically, any academy who can you practice with is
how many guys did you practice with?
So many. You can practice with all the candidates there, and there is also a mock test that you can practice with the seniors there who already are doctors in the UK or were at that time.
Exactly. So the important thing is that you practice, and you don't practice with only one person.
Exactly.
Practice with so many people. Practice with good people. شطار practice وياهم. لان انت
بالضبط
بعدين حيعدوك ويسووك شاطر.
بالضبط. واهم شيء انه اشخاص غرباء يعني على مودي عامل الستريس يكون مهم بهالموضوع لانه هو very stressful exam. But if you practice a lot, it will be less stressful at that time.
All right. And مروة شنو الريسورسز اللي استعملتيها لبلاب 2؟
PLAB 2, as I mentioned earlier, I went to Common Station. It was academy 14 days back to back, يعني أسبوعين كاملين. It was 12-hour session each day. And I practiced with my husband and my friend. So we were 3 people. We booked exactly the same hotel. يعني if you have the luxury that you and your friends go to the same academy and do the exam, that's great. But if it's not, I agree with Hassan. يعني foreign people, different languages, it will also force you to practice your English. And the stress factor is important because they're new. You're afraid they might judge you. At least you get to do that. But because we were 3 people in the same hotel, that gave us after every session, we would also go and practice and repeat the sessions and read them together and study every single day after the academy. It was intense, but as I said, because it's doable. If people are willing to do an academy, it is doable to do the exam few days short after you finish the academy. But nowadays people are doing notes, practicing self-studying. You can even practice on Zoom with some people. It's up to you what your style, but Common Stations for me worked great because Dr. Hamid is very يعني ستايله عراقي كلش خشن بالمعاملة. he was good at keeping us in awake all the time. Yeah, like having a 12-hour teaching session is intense, but he kept it very engaging. So it was really good. And also the material he provided, we were lucky enough. تقريبا the 3 of us had 2 different exams. So 2 different set of 16 stations, and alhamdulillah, I would say more than 70% of the stations were actually present in the academy. It's not an advertisement, but that's my experience. I would recommend an academy, but if that option is not present, obviously other people have other experiences and it worked very well for them.
Yes, that's very true, Marwa. I think academy is essential. I think it's very important. Whoever tells you that you can pass without an academy, he probably used an academy. Definitely, everyone uses an academy. It's very helpful. It gets you to practice with different people.
Absolutely.
What about you, Noor?
My experience might be irrelevant now because I've done it years ago. So I think the PLAB has changed multiple times since. But I did it with Swami Academy. I liked it back then. It was really good as well. But I'm not sure if that applies
Swami
now.
team all the way. I'm like Swami team. I love Swami.
Again, that was years ago, Islam. God knows what's changed since.
Yeah, كبرنا هسه عجزنا. All right. Any other questions? So whoever want to ask a question from the audience, maybe they can just raise their hand or they can unmute themselves. All right, I think
it looks
they got the jet. They got the
yeah, I think they got the point. It was very you went into too many important details and you kind of covered everything. I done the PLAB myself in our days. I was in the PLAB, but we didn't have any academy at that time.
Yeah.
It's all done DIY. We were used to sit in the student house in Holborn Road. There's a student house and people comes in, and the group study, as you said, is very important because keep you motivated. Because if you sit there and studying on your own, you get bored. Then you're going to meet people, listen to different ideas, and it worked. But for me, I struggled. In order to pass that to PLAB, I had to wait for 4 years.
It was different back then. It was different back
Yes,
then.
exactly.
That's what they actually call it. Yeah, that's what they actually call the professional linguistic exam.
Yes.
There is nothing linguistic about it. They care about the language. You need to have like a understandable language. It's not about the language.
It was a different system altogether. If you fail anything, you fail everything. So at least now you have the luxury of passing something and leave it behind and go into the next one. But again, I guess you all in your prime as well. You are young in a certain age, which is you can devote more time and all that. Well, I'm very happy for all of you, really. You guys, you passed it and you made it and you started working. And I'm very happy for Zain and Hassan, who came from Iraq straight away and found a job, passed it. Islam as well, he done his bit. Noor, and we have Amna as well. So you are all you have a really interesting story to tell.
Yeah, Marwa and her husband as well. Her husband is one of my very close friends, yeah.
Absolutely, all of you guys, and you are going to be inspiration to everybody who's thinking about the PLAB and having doubts and all that. Thank you very much for all of you to come today, and hopefully we can see you in the future webinars. And thanks a lot for Prof. Haloub and Prof. Majid Al-Khatib for the nice ideas and advices and all that. And I would say, have a lovely weekend and bye for now. Bye.
Thank you very much. Thank you, everybody.
Bye-bye.
Thank you.
Thank you.